Congratulations, your baby's here and everyone is probably more interested in the new little human than you. Your body has done something incredible, but now it's time for you to heal. And let's be real, healing after birth is not just about resting. You're sore, you're bleeding, you might be stitched up, and you're somehow supposed to care for a tiny human on zero sleep. Well, I'm Brooke. I'm an obstetrics and gynecology doctor, and I'm also the mum of 3. In this video, I'm going to give you the most practical, honest, and useful tips to heal faster after you've given birth, whether that was by a vaginal birth or a C-section. We'll cover wound care, bleeding, sleep, mental health, and more. So if you want to feel better, faster, keep watching. So let's start with what is going on in your body after you give birth. Soon after birth, your uterus starts shrinking back to its pre-pregnancy size. This is called uterine involution and it usually takes about 6 weeks. You might feel some cramping, especially when you're latching your baby on for breastfeeding, and that's normal. It's your uterus doing its job, stopping the bleeding and getting back to its size. You'll also be losing some extra fluid that your body was holding on to during pregnancy, so you can expect to be running to the loo to pee more often in the first few days. Did you know that most people still look about 5 to 6 months pregnant when they leave hospital? So you should pack comfy, loose-fitting clothes, ditch those high-waisted pre-pregnancy jeans for now. Be kind to yourself. Your body just grew a human and that bump that you had won't disappear overnight. You've got some fat stores, you've got water retention and stretched muscles which all take time to recover. So gentle movement, staying hydrated and having some balanced meals can all help, but so can patience. Whether or not you breastfeed, your breast will also go through some changes. Around day 3 to day 5, you'll notice that your milk will come in, which means that your breasts will feel hot, they'll feel hard, they might even feel painful. So I recommend getting a green cabbage and placing the leaves into the freezer for a little bit, because frozen green cabbage leaves placed into your bra can work wonders for that engorgement feeling. Breastfeeding works on a supply and demand basis. The more that your baby latches on, the more milk that you make. So you should expect some discomfort at least, but pain that doesn't improve should always be checked over by a midwife or a lactation consultant. The other thing about breastfeeding is because it works on a supply-demand basis, especially at the beginning, responsive feeding is best. And that means that you plan your own sleeping around what the baby is doing. That old phrase, sleep when the baby sleeps, is much easier said than done. But the idea is that whenever your baby is awake, if you offer them a feed, it's going to help your milk to come in. And the more milk that you have available for the baby will mean that they'll feel full for longer. But at the beginning, they only need very, very small amounts. So them crying doesn't necessarily mean that actually they're starving. But what you should do is offer them the breast every time that they're awake. And when they are sleeping, do try and take that opportunity to rest. Now let's talk bleeding. Well, postpartum bleeding, called lochia, can last for weeks. It's usually the heaviest on the first few days, especially during or after breastfeeding. So use maternity pads or period underwear for that type of bleeding. Avoid tampons or menstrual cups for at least 6 weeks after birth to reduce the risk of infection. If you have had any type of wound, standing, sitting or moving around, and twisting after birth can be a lot more difficult than usual. So let's get into the most useful tips for healing wounds faster after birth. Whether you've had stitches or a C-section, these will help you to feel better quicker. Firstly, perineal care. So if you had a vaginal birth, you might have had some stitches, or even without, you might feel sore down below. Keep that area clean, rinse it with warm water after using the toilet and gently pat the toilet paper on it. You can use a peri bottle if you like, but otherwise a cup of warm water poured onto yourself as you're doing your wee can make a big difference. Avoid scrubbing that area or using any soap at all in the vulval area. Next, salt baths. These are shallow warm baths where you fill it with salt to help to soothe the soreness and reduce some swelling. 10 to 15 minutes a day if you're really finding it sore and stinging can make a big difference. Next, ice packs or cooling gel pads. In the first 48 hours, some people like the feeling of that kind of cold or that icy compress to reduce their pain and swelling. Just remember, just wrap that ice pack in a cloth or put them on the outside of your underwear. Don't ever apply it directly to the skin. You can also fill a sanitary pad with water and put it in the freezer and use that like a padsicle. Again, wrap it in something before you place it in your underwear. Next, C-section wound care. Keep that area of the C-section wound dry and clean. You should let the air get to it if possible. If you're at home, lie back, take the dressing off if it's been more than 24 hours and just let it get to the air. Avoid any tight waistbands that dig in on that area. So again, maternity clothes that go over the bump can be really helpful. Always look out for signs of infection in your scar, like any redness, seeing any pus, or if you get a fever, and do get checked out if you're worried. Next, pain relief. Well, don't try and be a hero. Paracetamol, codeine and ibuprofen are all safe even if you're breastfeeding, and they can help you to keep mobile and well rested. If you've been prescribed some stronger meds, also take them as directed, but it's a good idea to take regular painkillers for at least the first week after birth, regardless of which type of birth you had. Then, stay hydrated and make sure you're eating well. Your body needs to fuel to heal. Think fibre-rich foods to avoid constipation, especially if you've got some stitches you don't want to be straining. So on that note, straining is not your friend when you've just had a baby. So as well as drinking lots of fluids and eating fibre, you can ask your midwife about stool softeners if you need to. Some people like to have support when they're sitting or feeding, so you can use a cushion or a pregnancy pillow around you or to sit on if you're sore. And when you're feeding, use pillows to support your baby to bring them up, so you're not slouching or straining or twisting to hold the baby for breastfeeding. And final tip, if your wound smells or if you're bleeding heavily or it looks very red or swollen, get it checked. It's never a bother for us to look down below, and we can always give you antibiotics if you need. Here are some postpartum symptoms that definitely do not get enough attention. Night sweats. These occur due to dropping estrogen levels, especially if you're breastfeeding. That means that you might wake up in the middle of the night drenched in sweat. Keep your room cool. Wear breathable fabrics, and some people find it helpful to sleep on a towel or just change the bedding frequently. It can also be helpful to keep a spare pair of pyjamas by your bed. Make sure that you're staying hydrated with all that water loss. Next, joint pain. After birth, your joints can still feel loose or achy because of the pregnancy hormones. Be gentle with yourself. Avoid any high impact activity too soon after birth. Focus on just gentle movement like walking or swimming. Pelvic floor exercises are also super important, and so once you've had your 6-week check, for example, you might find that your joints are less achy and you can get back to your normal exercise. And mental health symptoms. Mental health matters. It's normal to feel overwhelmed, emotional or low after giving birth. But if the fog doesn't lift, or if you're feeling anxious, hopeless or just unable to cope, please do speak to your GP, your midwife, a health visitor, just someone. Mental health conditions are the leading cause of death in the UK after birth. You're not alone if you're experiencing these symptoms. There's nothing to be embarrassed about. Finally, insomnia. Yes, everyone says sleep when the baby can, and you know you're going to have disturbed sleep because baby's waking up in the night, but some people find it just really hard to sleep after giving birth. If you're utterly exhausted, ask for help. Try switching off notifications on your phone, let things go, try not to stress about how clean your house is or all those things that you need to do that you can't do because you're looking after this human. This time is fleeting, so get into bed, have some good skin-to-skin time with your baby, indulge in those box sets and try to avoid setting yourself impossible to-do lists. And as I mentioned, do ask for help. And whether you've got family around you, you can check in with a postnatal physio, your GP or a friend. Do use your support network. So remember, healing isn't linear. But with the right tips, you can feel better faster. So if you've been through this before and you've got any other top tips for others, please leave them below. Subscribe to the channel for more practical women's health content from a real gynecologist who's here to tell you the stuff that no one else will.